Everyone talks about what Medicare covers, but no one ever talks about what Medicare doesn't cover. There are 5 major items that Medicare does not cover, and not knowing what those items are could cost you thousands. If you stick around to the end of the video, I'll let you know how to get most of these items covered through your Medicare plan. Hello, my name is Edwin John Rodriguez, your health insurance representative. And on this channel, we discuss health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of working with individuals and families regarding their health insurance. And the best part is using me, who's completely free. The way I get paid is whichever insurance company you decide to enroll with is the one that pays me for my time. And that compensation is actually standardized through the federal government, ensuring that conversations are transparent and free from bias. I often tell my clients I'm the best free help you'll never pay for. Now let's get into it. So the first item that Medicare does not cover is long-term care. I get this question pretty much every month from a client asking me about their benefits related to long-term care. In short, Medicare does not cover long-term care. Medicare will cover items such as home health care or skilled nursing care, but generally skilled nursing care is going to be limited to 100 days in an inpatient facility. And the solution to get these covered is going to be to purchase long-term care insurance. Generally between 50 and 60 years old is the sweet spot when to purchase long-term care insurance. Some clients who may have missed that window or can't really find those plans to be affordable will then have to consider self-pay options when the time comes if long-term care is needed. Now, the second item that Medicare does not cover is dental care. So benefits like cleanings, x-rays, exams, routine dental care is something that's not covered by original Medicare. Now, if you have a medical condition related to dental needs, for example, you have a car accident and you smash your teeth out, you need to get your teeth repaired because it's related to an accident, that will be covered under the medical portion of Medicare. But for routine care, again, it's not covered with standard Medicare. The solution to get it covered is to purchase a standalone policy. A client brought to my attention a program called United Healthcare's Dental Wise Max. We'll include a link in the description below for the Dental Wise Max plan. But we found that plan to be a very wholesome plan for the price, where it actually bundles together multiple benefits. In addition to the dental, you have also items like vision and hearing, which will be included in that policy as well. Which brings us to number 3, vision and hearing is also not covered with standard Medicare. So items like eyeglasses, contacts, eye exams, hearing aids are items that are not covered with standard Medicare. Now, again, like dental, if you have vision problems related to a medical condition, that is something that will be covered under your policy. So for example, an ophthalmologist, that's actually a medical doctor that takes care of vision needs. For example, glaucoma, retinopathy, blurred vision, those are medical conditions, which will be covered by an ophthalmologist under the medical portion of your policy. But again, items like eye exams, glasses, eyewear, your hardware is something that won't be covered with standard Medicare. Now, the solution on getting those items covered is what I stated before, which is a plan with United Healthcare, Dental Wise Max. It's an all-in-one plan, which includes a dental, vision, and hearing, builds into one policy for a relatively affordable premium. So the fourth item Medicare does not cover is prescription medications. Now, in order to have prescription drug coverage, you will have to enroll in a standalone prescription drug plan or have a Medicare Advantage plan, which includes prescription policies built into the program. If you don't add prescription drug plan or have it included in your medical policy, you'll be paying full price for prescriptions when you go to the pharmacy. The solution in having these items covered is to actually purchase a standalone prescription drug plan or have a Medicare Advantage plan that actually has that program built into the policy. And fifth is going to be international travel. International travel is something that's not covered by standard Medicare. Now, there are some policies, if you go with a supplemental policy, like a Plan G, that will cover international travel. A lot of these Medicare Advantage plans do have a limited benefit for international travel as well. So there's kind of generally going to be a dollar amount that you'll be capped off at as far as how much you can actually use of the insurance company's money for foreign travel emergency care. Those benefits are related to emergency care only. So anything routine outside of the United States would not be something that's covered with those programs. Now, the solution in having international travel covered is, again, you'll have a minimal benefit tied into either your supplemental policy or to an Advantage plan. But if you're looking for more wholesome coverage for international travel, you may want to consider international travel insurance, which would give you more wholesome coverage for care while you're abroad. In addition to medical care, sometimes international travel will also include additional benefits like changes to your itinerary or travel plans for things like hotels and flights. As a bonus tip, I wanted to tell you how to actually have most of these items covered by Medicare. You ready for it? Medicare Advantage plans. Yes, Medicare Advantage plans actually include more of the benefits tied into one policy. As we stated earlier, with Advantage plans, you have items such as dental, vision, hearing. You have a gym membership on most policies included part of the program, prescription drug plans included, as well as having coverage for international travel, again, limited benefit. Now, one thing that the Advantage plans do not cover, which none of these Medicare policies do, is long-term care. So that is something you want to prepare for accordingly or set some money aside for when that time comes. To recap today's video, the 5 things that Medicare traditionally does not cover is going to be first, long-term care. Next is dental. Third is going to be vision and hearing. Fourth is prescription drugs. And finally is international travel. So if you already know which plan makes most sense for your needs, we'll include a link in the description below, which will be called Enroll in a Plan. And that will allow you to actually go ahead and set up your program based on what you feel is best from the information you learned. If you need more help or prefer more personalized guidance, please feel free to schedule a call with us using the link in the description below. And that, ladies and gentlemen, is a breakdown of what Medicare does not cover. If you found this information helpful, please remember to like and subscribe. Subscribing to the channel will keep you up to date on all the changes related to Medicare. The industry of health insurance is always changing, and staying subscribed will ensure that you're staying up to date with information and changes related to Medicare. If you'd like more information related to Medicare, consider watching this video here, and we'll see you on the other side.